Welcome to CAMHS. What CAMHS means is that it's a service for children and adolescents or teenagers with mental health difficulties. What we'd like to do today is to share with you a little bit of a tour of the building, because children, young people and parents have told us that it can be quite daunting coming to CAMHS. So what we want to do is we want to do everything we can to make you feel at ease. So this is our reception area, and when you come for your appointment you'll see a nice smiling friendly face behind the desk. What they'll do is they'll ask you for your name, they will share that with your therapist, and they will ask you to take a seat in our reception area and wait for your appointment. So this is what the waiting room looks like at the moment. When you come to CAMHS it may be different, because over the next few months we hope to work with children, young people, parents and carers in changing the way our environment is. So we're going to have Takeover Day in November 2015 where we change the environment in the reception area and other rooms. As we're quite a busy service and we want to help a lot of your children and young people, it may be that you might need to wait a little bit for your appointment. So something that you might want to do is bring a book or a magazine. We also have lots of information around on the walls. We have information about our participation groups, which is our service user group for children and young people, and we have a separate one for parents and carers. And this is where you can find out information about the service, you can tell us about your experiences, and you can share your views so that we can transform services for the better. So this part of the building is where you would have an appointment with your therapist or clinician. This part of the building used to be called the day unit, but now we use it for meetings and for individual appointments with children and young people. We also have a separate building where we have appointments with children and young people, and that isn't attached to this part of the building, but it's close by up the path. So this is an example of what a therapy room would look like. But what I'd like to say to you is expect to look at some paperwork when you come. What this paperwork is for is to help us get a clear picture of what your needs are. We will then look at this and make an assessment of your needs and see which interventions we can offer to you. These are called ROMs, or routine outcome measures. And routine outcome measures are really important because they help us to know that what we're doing with children and young people is right, that it's evidence-based, which means it's proven to work. We're always trying to improve our practice, and by completing the questionnaires with us, you're helping us to get a clear picture of what our service is doing. It's really important to us to know that we're meeting your needs. So here are some examples of some questions we might ask you after you've met with your clinician or therapist. So we'll ask you things like, did you feel listened to? Did you talk about what you wanted to talk about? Did you understand the things said in the meeting? Sometimes when we're professionals we use big words, which is called jargon, so it's important to say if you don't understand something that's been said to you. And did you importantly feel that the meeting gave you ideas about what to do for your own needs?